Mr. Speaker, on this 9th day of this emergency sitting of the legislature, the NDP have increased the PST without the legally required referendum. But, Mr. Speaker, we are still waiting for sensible expenditure actions to save costs. The Minister of Child and Youth Opportunities, Healthy Child Manitoba 2012 report illustrates the government's failure to prioritize rational approaches to keeping kids healthy and to preventing the need for expensive procedures. For example, on page 45, we see that the number of dental surgeries in children up to age 5 has increased. I asked the Minister of Children and Youth Opportunities how he plans to effectively address the escalation in early childhood dental surgeries.
Mr. Speaker, the first and most important thing for any child to prevent tooth have access to healthy food. And that's exactly why we have, compared to a decade ago, about 5 gardens in northern Manitoba, 900 community gardens in northern Manitoba. A gigantic difference. We've also increased the northern food allowance 7 times in northern Manitoba to help people have access to better quality food. Community gardens, northern food allowance, better opportunities to be in school with an increased emphasis on a graduation rate and an opportunity to learn how to look after yourself and to be able to thrive in the world. Those are just some examples of how we're helping young people prevent tooth decay and get off to a better start in life in Manitoba.
Mr. Speaker, but it hasn't worked. Foresight and prevention can be extremely effective and simple approaches to reducing both physical pain and the financial costs of these early childhood dental extractions. But instead, the present government has let it fester into a financial abscess with more and more surgeries needed. And they have to raise the PST to cover them. In the Burntwood region, for example, the rate of dental extractions is nearly 8 per 100 children. This is a very expensive approach to a problem which can be prevented at much lower cost. I asked the Minister of Children and Youth Opportunities, what actions will he take to address the extraordinarily high dental extraction rate in the Burntwood region?
Mr. Speaker, not only are we providing access to healthy foods, freezer programs so people can store the food that they grow, an increase in the northern food allowance so they can have access to higher amounts of good quality calories. In schools, we've discouraged the use of soft drinks and selling soft drinks in schools. We've encouraged more physical activity for young people, and we've encouraged them to have access to proper training and education so they can get jobs and lead a better quality of life. Dental extractions are a serious problem for any young child that has to experience that. We want to make sure that they, first and foremost, have access to healthy foods and nutrition so that they don't have to decay their teeth and then require these procedures, Mr. Speaker.
Mr. Speaker, in 1999, the day that the NDP cabinet was sworn into office, I said, and it was quoted that day in the Free Press, how the new NDP government addresses the issue of dental health for children will be a test of whether Gary Doer and his team can make a real break with the disastrous health policy of the previous Tory government. Clearly, with the increase in early childhood tooth decay and the increased surgeries for children under 6, the policies of the NDP are not working. I asked the Minister of Children and Youth Opportunities, what actions will he take to reverse his own government's disastrous policies over the last 13 years and 9 months?
What we have done is we've introduced the Healthy Child Initiative in First Nations communities across Manitoba. We provide a prenatal benefit to young expectant mothers, no matter where they live in Manitoba, including in First Nations. I only remind the member opposite, he talks about 1999. He was in the federal Liberal government in 1996 that cut the Canada Assistance Program, which required that all families have access to the necessities of life. When the Canada Assistance Program was eliminated, that triggered all the action across the country, which took away the necessities of life for people. Shame on him, Mr. Speaker.